Well, the day that this happened was a Friday, and I had seen or visited several palliative care patients on the 9th floor. It was late in the day, and after visiting the patients, I talked with the nurses at the station. So when I left the department, everything seemed fine. About 15 minutes later, I got a call from one of the nurses who said, "Dave, we want to come and talk with you." So they came to the burn center and they said, "Dave, we think you might be having a TIA, a mini stroke." And I said, "Why?" And they said, "Well, your speech is kind of slurred and the side of my mouth was really drooping." So they were concerned. They were very concerned. But they didn't know if it was appropriate for them to say something, but out of their concern and their nursing expertise, they brought it to my attention. And I think there was a part of me that thinks, oh, because I work in a hospital, I'm a healthcare professional, I won't have a stroke. It won't happen to me. But it did. So yes, they gently helped me to make that decision. So once I made the decision, they had taken care of everything. They had contacted the house supervisor, who walked me over to the ED. I went immediately into the red zone, a treatment room. I'd seen 2 doctors within 5 minutes. With stroke, there's a time urgency. But the point is, they cared enough from their hearts that at the end of a busy day, and they probably wanted to go home, they cared enough to speak up and took action. It's not just me against this big, cold world. I've got a community of supportive employees, coworkers, friends, family. And since then, whenever I go back to 9 West, it's like reunion day. The nurses, "Oh, Dave, we're so glad you're here. We're so glad you're okay." It's like family. It's been very heartwarming. I feel connected. I feel like I'm part of something bigger than myself. It's part of a family, part of not just a business, but a family of people. And I see that all throughout the hospital. Before coming to work here, I had done internships at other hospitals. Very good places. But there's a difference in the nurses here. I really believe that. They care. They care because of the mission of the hospital. But the difference is the nurses here seem to really, really care about the patient, about the mission, about the fact that the patient with a clinical problem may be having trouble at home. They care and they want to help. So I feel connected.